All right, here's our goals. Our first step is our objectives for this lecture is to recognize and explain the significant values of the ABG interpretation, relate the pH scale to acidosis and alkalosis, and interpret basic arterial blood gas values to the patient conditions. All right, blood gas values, first go through. You're looking at, this will help you determine whether acid-base status, if it's underlying cause of the imbalance, and your body's ability to compensate for it. Some numbers you really need to make sure you're knowing is your pH has to be between 7.35 and 7.45. We talked about that in the last lecture. Your CO2 needs to be 35 to 45, and your bicarb is 22 to 26. So these are the numbers you should always be looking at when you're looking at ABG interpretations. When doing an ABG interpretation, your best approach is to first determine if it's acidotic or alkalotic. So you're going to look at the pH. Second, you're going to try to decide if it's a respiratory or metabolic issue. You do that by looking at the CO2 and the bicarb. And then finally, you look at whether the body is compensating for the acid-base imbalance that it's in. Remember, the body's always trying to maintain homeostasis, so you want to make sure you're checking to see how well it's doing. All right, 5 key components. We kind of talked about this a couple times now, just in different forms. First, evaluate the pH. Right, you look at it. If it's above 7.45, it's alkalotic. If it's below 7.35, it's acidotic. And then your pH, your CO2 is 35 to 45. So, anything outside of that's going to help drive your acidosis and alkalosis. And the same with your bicarb. If it's 22 to 26, outside of those ranges are going to be driving your acidosis or alkalosis. The mnemonic I use for interpreting ABGs is ROAM. Basically, it goes respiratory is opposite, metabolic equals. So, for example, if your pH is going up and your CO2 is going down, it's going the opposite direction, it's a respiratory issue. If, for example, your pH is going down but your CO2 is trending upwards, it's opposite direction still, and it's a respiratory issue. But if your pH is going one direction and your bicarb is going the same, then it's equal, and that's a metabolic issue. Okay, here's another quick way to look at it, just kind of breaking down how to read these mnemonics and just another visual representation of that. So what if the pH is normal but the other values are abnormal? So if you have a pH of 7.36 but your bicarb is out of range and your CO2 is out of range, well, then you're looking at a compensation. So your body is compensating for the acid-base imbalance. Remember, we talked about your body's always trying to figure out a way to make it work. Well, it sometimes it does. So a way to think about if your pH is normal is you got to look at it a little closer instead of just between 7.35 to 7.45. Remember, 7.4 is in the middle, so anything below 7.4 is going to be slightly acidotic or trending acidotic, and anything above would be trending alkalotic. So first you're looking in goals of ABG analysis. First thing you do is you're going to check to see if it's acidotic or alkalotic, and then you're going to go through and check to see if it's a metabolic issue or a respiratory issue, and then you're going to be discussing final interpretation is whether it's fully, partially, or uncompensated. Kind of talking about the same thing here, just so you know, compensation, we look at the opposite value or the other value, the alternate value. For respiratory problems, you're going to look at your bicarbonate to see if there's compensation. If it's a metabolic problem, you're going to be looking at your CO2 to see if it's compensating. Remember, fully compensated, your pH is normal. If it's partially compensated, all three of the values are abnormal. So your pH is out of range, your bicarb and your CO2 are all out of range. And if it's uncompensated, then usually your pH is out of range, and then either your bicarb and CO2 are out of range, but the other one is normal. Because that's basically saying you're in a metabolic or respiratory acidosis or alkalosis, and the other side is just kind of chilling out and not doing anything to fix it. So we're going to do a couple practice questions now, just so you can see examples on how to interpret these. We will definitely be spending a lot of time in class going over these and interpretations. First one is your pH is 7.76. So if normal values is 7.35 to 7.45, 7.76 is trending upwards, right? Which means it's alkalotic. All right, the second number you're going to look at is CO2, which is 34. Right here on your little chart down over here, 34 is low, so it's kind of trending down. So right off the bat, you look here, you got your pH going up and your CO2 is going down. You know it's a respiratory issue. Finally, you need to check this for compensation, and your bicarb is normal. So remember, if your one area is out of range, but the other alternate, the counterbalancing form, either the bicarb is normal, that means it's uncompensated. Your body hasn't done anything to correct this CO2, the acidosis that's caused in your respiratory system. All right, here's just kind of a verbal breakdown of what just happened. Going through the next one here, you've got 7.37. Remember, 7.35 to 7.45. So it's normal, but slightly acidotic, right? So it's trending down. So it is still acidosis. Next thing you're gonna do is you look at your CO2. CO2 is at 50, and 50 is going up. So then you know it's going the opposite direction. So it's a respiratory issue. And then you're gonna look at your bicarb. Your bicarb is 38. So 38 is definitely above the 26, right? So now if you look at it, all three of them are out of range. So I'm sorry, not out of range. So your pH is in normal, but the other two are out of range. That means it's fully compensated. Your body has fixed the pH of whatever the respiratory concern is doing by increasing this bicarb. A disease I always think of with this is like your COPD patients, right? They're not able to do good oxygen exchange. So what's going to happen? Your carbon dioxide is going to hold. It's going to be elevated. And then when you're looking at an elevated CO2, since it's usually a gradual thing with COPD, your body has time to acclimate for it. You have time to start holding on to bicarb and excreting extra acid through your kidneys, holding it. So you're going to have elevated CO2 to counterbalance the elevated CO2 and keeping your pH in normal. So it's fully compensated respiratory acidosis. All right. Next, what we're going to do is we're going to look at 7.79. 7.79 is way above 7.45. I think that's just below someone dying. So you're looking at an alkalotic picture. Next thing you got is a CO2 of 47. So the CO2 is going the same direction, which if it's a respiratory problem, they'd be going the opposite way. So then you know it's a metabolic concern. And after you look at the bicarb going the same direction, your pH, so they're going the same way, so it definitely is a metabolic concern. So now you've got all three of them going the same direction, or all three of them are out of range, meaning it's partially compensated. So you've got an elevated CO2, you've got an elevated pH, you've got elevated bicarb, and your body is retaining CO2 to try to compensate to hold on more acid, to try to counterbalance all that extra bicarb to help drive down your pH. So right here is just the more verbal breakdown of what we just went over. So that is the basic steps on how to interpret ABGs. This is something you're going to really want to make sure you're familiar with going through up through the exam and as well as in your practice. A lot of times with patients, you're going to be weaning on vents, or if you're going to make sure their oxygen is saturation, besides looking at their O2 sats, you want to make sure they're doing good air exchange and those kind of things. So it's definitely something you want to make sure you're familiar with. Right here on the calendar is my email address. You're welcome to email if you have any questions. Here's my calendar link. Click on this and you get to my calendar. You can set up office hours.